What's wrong today?
Babe, I need to tell you something.
Yeah, what is it, sweetheart?
I'm pregnant.
What? You're pregnant? How did this happen? This can't be right now. I'm only 20. I can't be a father. I have my whole life ahead of me. You can take care of it by yourself. This is stupid. Goodbye.
I'm pregnant, but I don't want the baby.
There are many drugs that are abortive that can definitely help you through that, Michelle.
How do they work?
Mifepristone is a non-surgical abortion pill used for women in early weeks of pregnancy. It is also used in combination with misoprostone. Mifepristone is an anti-progesterone, binds to the progesterone receptor to block the receptor, thus inhibiting progesterone from binding. It does not activate a true biologic response. However, it does have a weak anti-glucocorticoid and anti-androgenic activity. Mifepristone also softens and dilates the cervix, causes testicular necrosis, increasing uterine lining, prostaglandin release, and increases uterine contractions. It also enhances uterine sensitivity to administered prostaglandin. Mifepristone ends pregnancy by blocking the hormones necessary for maintaining a pregnancy. Methotrexate is a folic acid antagonist and damages the rapid growth of the villi, which is in turn effectively dislodges the pregnancy from the uterus. Misoprostone causes the uterus to contract and empty.
Misoprostol inhibits gastric acid secretion by a direct action on the parental cells through binding to the prostaglandin receptors. The activity of this receptor is mediated by G proteins, which normally activate adenylate cyclase. The indirect inhibition of adenylate cyclase by misoprostol may be dependent on guanosine 5-triphosphate, which is your GTP. Its significant cytoprotective action is related to several mechanisms, such as increased secretion of bicarbonate. Also decreases in the volume and pepsin content of the gastric secretions. It prevents harmful agents from disrupting the tight junction between the epithelial cells, which stops the back diffusion of H-ion into the gastric mucosa. It increases thickness of mucus layer and enhances mucosal blood flow as a result of direct vasodilatation. Stabilizes vascular endothelium and helps the improvement of mucosal regeneration capacity. By selectively binding to the EP2 or EP3 prostanoid receptors, misoprostol has also been shown to increase the amplitude and frequency of uterine contractions during pregnancy.
But Michelle, there are many side effects associated with this drug. For example, you're going to get nausea, you're going to get headaches, and you're going to get vaginal bleeding for about 12 hours after the treatment. And you're also going to get really severe cramps, and they resemble the period pain. And you're also going to get diarrhea and hot and cold flushes.
Abortive drugs have a tight restriction in Australia. The TGA only allows registered doctors to supply mifepristone and misoprostol. As of 2015, the Tablet Foundation has been running to provide over-the-phone abortive pills, which will be useful for women in rural areas. Also, the TGA listed mifepristone on the Australian Register of Therapeutic Goods in 2012, the statutory declaration of NSW. Abortion can be a crime for women and doctors, legal when a doctor believes a woman's physical and/or mental health is in serious danger. In NSW, social, economic, and medical factors may be taken into account. Other clinical uses of mifepristone include gynecological condition, cancer, and Cushing's disease. Misoprostol is used to reduce the risk of NSAID treatment of gastric ulcers, treat and prevent postpartum hemorrhage, used for gynecological and obstetric health indications such as cervical ripening and the induction of labor.
Alright, so where's your partner today?
He left me. He's not gonna come back.
So is that part of the reason you're terminating your baby?
Yes, it is. And also, I don't have enough money.
Alright, so I can see that you do fall under the regulatory terms of taking this drug, and I can see that you actually suffer from some mental instability and socioeconomic class problems. So now we must take a blood panel to check how far you are along the pregnancy. So do you mind us doing that?
No.
I also need you to come back whenever you book your next appointment so I can witness you taking the drug because that is my legal obligation. Do you mind doing that?
No.
Okay. So now I need you to sign these papers for me.
Sure.
No, stop, don't do it anymore, sweetheart. I love you and I want the baby. I want you back. Please, come back to me.